If you were in pain and a doctor reached over the counter and handed you a pill bottle and said that this was meant to help you to reduce your pain, you would probably feel safer and better taking it than not. And that's the truth. But what if the same medicine that the doctor just handed you was actually had the potential to cause death and bodily harm to you? Ladies and gentlemen, welcome to the world of opioids. Opioids are one of the leading causes of addiction and death in the United States, and that's the dangerous reality of them. So today I'm here to persuade you that high dose and long-term opioid usage and prescription has significantly increased the risk of addiction and overdose. First, I'm going to explain the problem, then I'll show you the cause, and finally I'll wrap it up with a solution that fits the best cause. So let's get into it. The problem. The problem is that millions of Americans are being exposed to dangerous opioid prescriptions that can lead to addiction, dependency, and fatal overdose. These medications, intended for pain relief, have become one of the most deadly public health concerns in United States history. According to the U.S. Department of Labor, published on October 26, 2025, even low opioid doses between 20 to 50 morphine milligrams equivalent, MME, can present a risk, and physical dependence may most likely occur in as little as a couple of days. This means that a patient can follow a doctor's prescription on its regimen and still end up addicted. The Center for Disease Control and Prevention, or the CDC, have reported on April 5th, 2024, that over 28% of opioid overdose in 2023 involved legally prescribed medication, meaning that these patients were overdosing off of medication that they were meant to take for their illness. And this is irrelevant from their illegal street drugs. These deaths happen to people seeking relief and help for their issues, not people intentionally searching narcotics and a high. Extended release versions of opioids have been on the market for years. A study published in the Journal of Pain Research on January 9th, 2023, found that extended release opioids are linked with significantly higher overdose rates than immediate release forms because they linger in your body longer and your brain adjusts to that feeling in a much greater way. The epidemic has continued to grow. The American Journal of Public Health reported on August 14th, 2023, that states with higher prescription rates had a 63 more hospitalization rate related to opioid addiction than states with stricter prescribing practices. In other words, the more the doctors felt the need to prescribe, the higher the rates the patients were addicted. Patients are risking addiction and death from an illegal prescription. Now, let's get into the cause. The cause of this epidemic comes down to opioid prescription. The rapid tolerance nature and dependency that makes stopping extremely difficult for opioids is really what makes them deadly. Because people are utilizing them correctly. Irrelevant of the malpractice, when people take what they're supposed to in terms of their prescription, ending up addicted is the issue. Opioids bind to the receptors in your brain in order to block pain, but over time the brain adapts to that feeling and eventually leads to a higher raised tolerance, which means people need more of the opioid to achieve the same pain-killing effect. According to the National Institute in Drug Abuse, published on June 10th, 2024, increased doses are often required to maintain pain relief, and the cycle fuels misuse and addiction. As tolerance grows, patients begin needing higher dosages in order to satisfy their pain. And that means the body becomes dependent on an outside substance to subside its own issues. So small dosage increases raise overdose. Small dosage increases raise overdose risk because the brain struggles to regulate breathing when exposed to more opioids than it's supposed to. The cause is not just that patients are irresponsible. It's that opioids are naturally fundamentally rewire the brain, forcing the brain to crave more. When the medication becomes too powerful, an overdose quickly becomes a fatal consequence. If the cause is biological dependency triggered by usage, then the solution must target how these drugs are prescribed. Now, we'll begin with the solution. The solution is quite honestly simple. Stricter prescription guidelines that limit high dosage and long-term opioid use while expanding safer pain management alternatives. Whether that comes out to prescription or research or any type of form that needs to be done to seek these external pain management resources, we need to get on it right now. The CDC recommended in September 29, 2022, that they updated guidelines that doctors should favor non-opioid therapies over the traditional ones and prescribe only the shortest and lowest possible doses when opioids are in the picture. The policy needs to be enforced, not just suggested. To address the cause of rapid tolerance, prescriptions must avoid extended release opioids as a first-line treatment, stay below 50 MME for as long as possible, be limited to short durations, and require heavy follow-up and monitoring regarding patients. Additionally, health systems need to expand their infrastructure. Safer options such as physical therapy, non-opioid medication, and nerve-targeting treatments must all be implemented at a quick rate. If the cause is tolerance and dependency from dosage, then you need to limit the dosage from its source. We've seen that opioid prescription has posed a serious threat. We've talked about it. We discussed how the cause is rapid tolerance and dependency that's driven by the brain's reaction to opioids. And we found that the solution is stricter limits on dosage and duration, supported by safer pain management infrastructure. To repeat my thesis, I set out to persuade you that high dose and long-term opioid prescriptions greatly increase the risk of addiction and overdose. Medicines should never be more dangerous than the pain in which they aim to solve. A pill prescribed in trust should never cost someone their life. When pain is temporary, treatment should not become a permanent. That would be a consequence more than an aid.